Welcome to the Best of Beaver County, presented by St. Barnabas, a weekly segment dedicated to putting the focus on the amazing things and the amazing people behind them in Beaver County. The Best of Beaver County is sponsored by and content is provided by St. Barnabas. The show airs every Thursday from 11 to 11:30 on WBVP, WMBA, 99.3 FM, and Facebook Live. Now, with no further ado, let's welcome host Mike Romai to introduce today's program.
This is Mike Romai, and this is the Best of Beaver County on the St. Barnabas radio station. Because our topic today and the initiative St. Barnabas has started is so very important, Jeff Boast is back with us again today as we continue the conversation for dementia prevention and memory care. Jeff is a neurosurgical physician assistant. He has held or co-sponsored many symposiums and associated medical conferences focusing on all facets of memory care and dementia. Jeff, along with Dr. Maroon, has co-authored on a book called Fish Oil, the Natural Anti-Inflammatory. Today we'll speak with Jeff about the topic dementia symptom interventions, change, medication, and environmental safety. Jeff, good morning and welcome back.
Thanks, Mike. Glad to be here.
Good to have you back on the show. One of the things we spoke with Mitch Hobaugh last week about was how technology is changing and increasing our ability to provide a more proactive approach in recognizing and evaluating certain symptoms of dementia in a stay-at-home setting. Can you talk a little bit about that?
Well, it's the technology is advancing, the science is advancing, and we're getting away from some of the toxicities that used to be used routinely in people with dementia as far as behavior control, and that was drugs and medications. We now know that things that stimulate the brain, meaning whether it's mental stimulation, physical stimulation, social interactions, all have a much more positive, lasting effect than medications that sedate and basically put someone into a coma that their behavior is not even recognized. So that's the major advancement, is a big shift in recognizing that the drugs basically, again, say no to drugs in this sense. But the technologies are there to stimulate the brain, and that's one of the most important things that we're learning about dementia and Alzheimer's, is that things like television are really not enough stimulation. We need to really get into other modalities, whether it's interpersonal interaction, or at St. Barnabas, we're working with virtual reality, where the person's actually transported virtually to outside environments and other environments that they would never have had access to, whether it be traveling through Paris or some other travel or just experiencing nature. That's very stimulating to the brain and can definitely help.
So why is it so important for, say, the at-home caregiver to have some understanding about these new research studies?
Well, I think it is getting out there, and fortunately, and I know St. Barnabas has an excellent support group, there's a lot of information and resources available, whether it's volunteer-type situations or professional help, that the caregivers, that information is available, and St. Barnabas certainly is one of the best places to start to learn about it. But the idea of a caregiver giving care to someone who has progressive dementia at home is really becoming the way to go for as long as possible. And that's the most important thing to realize, is when we get to that tipping point, there are other resources available in a place like St. Barnabas, but a lot of people can be taken care of and live safely and happily in their own home with caregivers available. So these are some of the things that where some significant advancements are happening.
So what are we learning about the studies, and what are they revealing about the new research and treatments?
Well, yeah, the number one thing is that we know that certain medications that are routinely ordered by physicians to help medical problems such as diabetes or high blood pressure are good for those conditions, but they're not so good for the brain and not so good for dementia. If your blood sugar goes low, your brain doesn't function well, and you can have your symptoms of dementia made worse. Certain blood pressure medicines can drop the blood pressure too low, and again, not getting enough blood to the brain can also cause problems. Sedatives, sleeping pills, alcohol, they all depress the brain function, and so avoiding those as much as can be possible are also important. But the other thing that we're learning is, and just a study recently came out about it, and it's very important, is to the benefits of being outside, being in nature, being exposed to environments that can stimulate, whether it's just bird watching or feeling wind on our face. That is very stimulating. And so those are some of the things that we're learning, that outside and physical exercise also is important. Whether you have dementia or not, unless you're incapacitated physically, you can definitely do some type of physical exercise which provides more blood to the brain and stimulates the brain at the same time.
Jeff, there's so much new terminology that I'm learning from doing this program with you through St. Barnabas. What is a symptom intervention?
Well, it's a symptom/behavior intervention, and I think that's really, as we said, there's tipping points where someone, loved one, or other caregivers can't just handle the person at home anymore, and the intervention is multifaceted. It's professionals are involved, the family members are involved, and the person who has the dementia is involved. And it's the idea of getting to a solution that's best for that individual. It's a custom solution to think about what are the needs of the family, what are the needs of the patient or the person with dementia, and how can they be best suited, whether at home or in a place that can care for them more completely.
And what does this do for the quality of life for the patient?
Well, it's critical. If you have a mismatch in any of those areas, the person who is the caregiver, the stress that's involved in not being able to manage someone or take care of someone properly at home can be overwhelming. That can lead to disease and problems of caregivers, whether it be stress or anxiety, inability to sleep, all those things. So burnout associated with being a caregiver is well documented, both mentally and physically, the deterioration that can happen when someone is overwhelmed taking care of someone who has dementia. So that's really a huge problem, and one of the early red flags of why someone may need to be sent to or brought into a facility with more support.
Are there some symptoms that medications can be used to treat those who stay in home?
Well, I think there are definitely medications available, and the issue is as we get older, which dementia affects us as we get older, and Alzheimer's, the sensitivity to these medication changes. There's actually a paradoxical effect of some medications that are supposed to sedate actually can stimulate people as we get older. So the side effects associated with medications can be more pronounced in someone with dementia or as we get older. So medications are certainly a solution in some cases, but it really, the shift, as I said early on, was the fact that we now know that behavioral changes can be oftentimes more effective, have less side effects, and be more permanent in some respects than medications.
And Jeff, research is indicating that treating the behavioral symptoms of not only allows people with Alzheimer's to be more comfortable, but it also makes things for caregivers easier, certainly making the quality of life better for everyone involved. Absolutely.
You can't have a caregiver who is just at wit's end. You have to match the services to provide for that person, whether it's breaks. I know St. Barnabas has support groups where caregivers get together and they swap stories and discuss things that they've found that have worked. So having a friend, having a buddy, having a support group is really critical, to give that energy back, so to speak, to the caregivers. And the same time as, seeing someone and being with someone 24 hours a day, everybody needs a break. So the the idea of taking care of the caregiver, taking care of the person who has a dementia problem, and sorting out what outside services can be provided, whether they're professional or volunteer, is critical. But I think most people now realize that, there is a tipping point, because these are progressive conditions, and at some point, more professional environments are required.
Yeah, but it seems like the quality of life for everyone involved, especially the stress level, is definitely improving through these techniques.
It is, and that's the great thing about it, is the recognition, the word getting out there, such as this radio show now and others, St. Barnabas doing free evaluations. All these things are helping people to realize there is help out there. It's just not everybody has to go to the very brink before something needs to happen. There are things that can be done along the way.
Mm-hmm. Now, St. Barnabas offers both at-home and outpatient memory care services. Talk a little bit about each one and some of the expectations.
Well, as you said, you had Midge on last week, and she's the director, and I can't think of a better person than her to, provide that information if you were to call the facility. But I can tell you, having been there a number of times and seeing what's happening, the inpatient and outpatient treatments are excellent. Primarily, the outpatient is done with therapists coming to your home for specific targeted issues. For example, if the person has having progressive memory problems, certain memory training can help, whether it's physical therapy that they're having difficulty walking, or managing feeding, or managing things like shower and hygiene. Those things are available through home care. So there are resources that a person, obviously if it's a spouse, they're generally about the same age as the person. So physically, it's just sometimes impossible to care for all the physical needs that are required. So there are available things at the home. And then once, if it's decided and determined that someone needs to go into a facility like St. Barnabas, that's when all the resources are called together, whether it's nutritional, safety, the group therapies and other interventions that are done, and the stimulation that can occur in those environments, things like virtual reality, the outdoor activities that are done. So those are really taking it to another level and are important because this is a progressive problem.
Mm-hmm. So research again indicates that the numbers of people with Alzheimer's and dementia are increasing, and by the year 2025, these numbers will continue to go up. So it's important at every socioeconomic level to have this kind of program, and St. Barnabas has been on the cutting edge of this now for a while. Tell us why that's important, and St. Barnabas is the leader.
Well, it's very important because if the numbers are going up, which they are, as you said, Mike, there'd have to be, just in this area, 100 or more St. Barnabas to facilitate all the patients that would be required. So the idea of shifting and having the home available with caregivers and other resources is critical as a buffer because those numbers will continue to increase. There's only a certain capacity for the care as far as in a place or a facility. So that's important to have some re-emphasis on the ability to take care of someone at home.
All right, Jeff, we're going to take a short break here, and then we'll be back to talk more about memory care at St. Barnabas Health System. Jeff Boast is our guest on the St. Barnabas radio station. This is the best of Beaver County. When you go shopping, I guess an important phrase is shop and save, right? That's what you want to do when you're shopping. You want to save. And St. Barnabas Health System has expanded over the past year in terms of their outreach to the community. And part of that is the Shop and Save supermarket on Tuscaroras Road in Brighton Township. It's part of the St. Barnabas Health System, and they're growing. It's been a year and they're growing and they need more employees. So they're hiring for cashiers, bakers, meat cutters, and a number of other positions to add to their mission. All employees, listen to this, write it down, they offer paid training, flexible schedules, and career advancements. Now, if that sounds attractive to you, and there's no reason it shouldn't, you should get the number for St. Barnabas, which we have here. The store is located at 4935 Tuscarawas Road in Beaver, accessible from any place in Beaver County. Contact the Human Resources Department at 724-444-JOBS. At the St. Barnabas Health System. You can get it online as well at stbarnabashealthsystem.com. And St. Barnabas is an equal opportunity employer. And like Billy May says, that's not all. Beaver Meadows is the living facility located at 5130 Tuscarawas Road in Beaver, and it's part of the St. Barnabas Health System. They're hiring for a unique nursing position that offers a Monday through Friday schedule. Can't beat that. Are you a licensed practical nurse? If you are, we want to learn more about your experience and how it will contribute to our mission. For more information, contact Human Resources at St. Barnabas, 724-444-JOBS. That's 724-444-JOBS, or visit us online at stbarnabashealthsystem.com. And St. Barnabas is an equal opportunity employer. I'm Mike Romai, and you're listening to the Best of Beaver County on the St. Barnabas radio station as we continue our conversation with Jeff Boast. Now, Jeff, earlier in the program, we talked about how medications can treat some symptoms. Can we talk a little bit about some non-pharmacological treatments?
Right. Well, the idea of treatment is multifaceted. Are you going to work on the underlying condition? Are you going to work on the behaviors that are associated with that condition? And one of the things we've talked about early on is the idea of prevention and intervention and prevention. So we don't want to, once someone has dementia, just say, well, it's too late. You know, this is going to progress, and there's really nothing we can do. A healthy diet, exercise, lowering stress, all those things that we had talked about before as far as prevention are just as important now. The progression of a condition can be accelerated with increased stress. The condition can be made worse if someone's sedentary and not being stimulated. So recently, I think I talked last time about the idea of the isolation that's occurring with COVID right now, accelerating people's dementia and Alzheimer's disease, and actually the positive things and the advances that have been made in the last couple of years have gone away because so many people can't be stimulated and aren't getting treatment. So the isolation is really been a problem, and how do you counter that, obviously, with stimulation? And as I say many times, the television doesn't count. You need to have interaction with humans, interaction with the environment, physical activity. All those things can help with Alzheimer's disease. So once you have it and you have behaviors, the other things that are very important is to get into routines. Alzheimer's disease, like anything, it needs to be in a routine basis so there's no anxiety coming up next as far as something happening different. We know at noon we're going to eat. We know at 2 we're going to do something, and so on. So developing a routine that includes physical activity throughout the day. Mm-hmm. And then memory training is also important. You know, it doesn't mean you can't continue to do some memory training, and there's simple games that are available online that do that. They can be, started immediately when someone has any signs of dementia. Now, again, this is a progressive problem, but we want to slow the rate of progression.
Now, is this driven by the type of dementia, and can it be done at home?
Well, the type of dementia, you're right, there's many different types of dementia, and it affects people in different ways. Some experience physical decline, other cognitive decline. Speech can be impaired, emotional lability. Some people get violent. Some people get more withdrawn. But all those things can be managed often at home if until they get to the point where they can't. So when is that point? That comes down again to safety, medicines being provided or not, because of some behavior problem of violence, the idea of clothing and hygiene. All those things are tipping points that can bring someone into a place like St. Barnabas.
Yeah, because I was going to say, at-home caretakers, what if they're sitting back thinking, I don't have any training to do this? Does it require a certain type of training?
Well, it just takes love, Mike, and someone who cares for you. I mean, it's not if that was a requirement, I think we'd have a lot of issues. But there are learning and things that you can learn to do, and I think that's the big thing that support groups can provide. We have St. Barnabas has excellent support groups. Other Alzheimer's Association support groups in the greater Pittsburgh area certainly are available. Online, of course, is another way to learn more about it. Family and friends, often church groups, and other things like that. And St. Barnabas has sponsored a number of memory care programs at the facility before COVID, and will continue to do that afterwards to help educate the community.
Yeah. At-home learning is probably a pretty difficult task, or sketchy in the best sense of the word, because now in the internet age, everybody goes online to try and diagnose their own problems. Can that be an issue? And where can people get the most reliable information?
Well, when it comes to health issues, you have to go to a healthcare provider. I think the internet has a lot of resources, and I use them personally, and have put a lot of information over the years online that are available. But the idea of vetting material and what works for you may not be the same that works for someone else who's posting on the internet. So I think the best way is to go to a healthcare provider. Start with your family physician, a PCP. Often they will refer you to a neurologist, a specialist in the brain. You want to rule out significant conditions that can cause problems, whether it be a tumor or some other issue like thyroid disease or problems with vitamins or minerals in the blood that can cause dementia. And then more resources are available through places like St. Barnabas, the Alzheimer's Society, and so on. But you do want to get the right information. There's no doubt about it.
Yeah, I was wondering what kind of information someone could get by going to stbarnabashealthsystem.com.
Well, right now the best way is to talk to someone in person. There's the free evaluations going on, and I can't think of a better way than to personally tell someone, this is my situation, this is what I'm dealing with. What solutions might you have, or information might you have? I think it's that one-on-one, especially in someone who may have trouble navigating the internet and so on, is critical.
Okay. What are some of the more important issues in a stay-at-home environment for both the patient and the caregiver as the cognitive rate declines? With us, those red flags, what are the signals in the home environment when the home environment is no longer safe?
Right. We've touched on a couple of those throughout our sessions, but it's important to go over them again. I mean, anything that involves personal safety, whether it's for the caregiver or the person with dementia, is critical. Be it falls, be it someone that's violent or striking out, losing your appetite and not eating, or just refusing to eat. When somebody becomes with significant malnutrition, not taking their medications. We always talk about leaving the stove on or something like that. But typically at the point where someone is really symptomatic, they shouldn't be anywhere near a stove. But these are obviously red flags. Wandering is a huge problem with someone with dementia, not knowing where they are and then getting out into the community and being lost. Certainly not allowing someone with dementia to drive, and the accidents that may occur, again, becoming lost. So these are all critical things that are the tipping points to bring someone into a more structured environment.
Yeah, Jeff, I can only imagine this scares the daylights out of people. Is there a natural progression with Alzheimer's and dementia? And everybody knows somebody who says, oh, be careful because they're going to get mean at some time, or they may leave the stove on, and that just heightens the anxiety. And God knows we all have enough anxiety in our lives already.
Right. And generally speaking, there's always warning signs and things that can be recognized a little bit earlier before we get to those points, but sometimes not. And not everybody who has Alzheimer's is violent. Sometimes it's related to, someone being withdrawn and more passive. So I think that a lot of things happen that, that are very individual as far as the decline that's associated with it.
Okay. So if someone is suspecting that a loved one may be having trouble, memory loss, or any number of the symptoms that you've talked about already, the first thing they should do is look into this program at St. Barnabas, because the first consultation is free.
Well, I think that's an excellent source, and St. Barnabas is willing and able to provide that information. Whether it's the first or second or third, somewhere along the line, that is important information that people need to learn about. Oftentimes, a caregiver is involved initially, or other families, but at some point, the idea of where do we go from here, St. Barnabas has the answer. So I'd recommend that as a step forward once the diagnosis has been made to get more information.
Mm-hmm. And how do you you could probably do this stealthily. You can look it up on your own without your loved one or family member knowing about it. But then there comes a point where you're going to have that conversation. Any recommendations on that?
Well, it's a conversation that's difficult in the best of times, especially if someone is still very with it in the sense that they might become angry or emotional. But there are ways of doing it, and then one of the best ways to do it is to be prepared and not do it individually, meaning have other family or other support available with you, and discuss it in a scientific way. The idea that we're here to help. Oftentimes a healthcare provider, like a physician, can be one of the first people to broach the discussion. This is what we're looking at. We're going to do the test. If it's not this, I think it is a problem with dementia or Alzheimer's. Where do we go? What are the supports? And oftentimes people do maintain some insight into their condition early on, and then later on they lose that insight. But it's important to have a plan and know where to go next when things tend to deteriorate.
All right, Jeff, I know stbarnabashealthsystems.com is the website. They can look up memory care there. What's the phone number for people to call?
You want to call 724-443-0700. And again, the website is stbarnabasmemorycare.com. And it's a free consultation, both by phone and, if needed, in the home. And there's trained professionals available to give you the information you need.
Jeff, as always, thank you for being with us and providing this very vital information for our listeners from St. Barnabas. Thank you.
Thank you, Mike.
Okay, 2021 is your year, right? You're looking forward to it. You're going to get out of this pandemic thing. You're going to get a new start. That's why you should contact the Shop and Save on Tuscarawas Road in Brighton Township, because they've got your key and the road to your future in different positions that they're hiring for. It's part of the St. Barnabas Health System, and they're hiring for cashiers, bakers, and meat cutters to join their mission. All employees are offered paid training, flexible schedules, and career advancements. For more information, you can visit the store, which is located at 4935 Tuscarawas Road in Brighton Township. Contact Human Resources at St. Barnabas at 724-444-JOBS, or visit us online at stbarnabashealthsystem.com. St. Barnabas Health Systems is an equal opportunity employer, but that's not all. St. Barnabas is hiring, so get your resume ready. get on, get yourself on the phone, get online and look up these positions, start filling out the application, because Beaver Meadows is the living assistance facility located at 5130 Tuscarawas Road in Beaver, and it's part of the St. Barnabas Health Systems as well. And they're hiring for a unique nursing position that offers